lately had one of the negotiators, Russ Feingold from Wisconsin, say that he has real reservations still about supporting something that would replace a public option. You have Blanche Lincoln saying, in effect, there wasn't a deal. You have Mary Landrieu saying the same thing. What Harry Reid tried to do last night was project momentum and say there was consensus where there plainly is not consensus. But if there is in fact a compromise, it's a compromise that single-payer advocates have already come out in favor of. You had Anthony Weiner say that he likes what he sees. You've had other pundits who have been in favor of a single-payer system because of the Medicare part and because of the restrictions, the regulations on the Office of Personnel Management part. This is something I think that they can sell to the left.
Charles?
The process here is bizarre. You know, all of a sudden, with the deadline looming, they're throwing in anything that will fit, anything that will get 60 votes, regardless of whether it's incoherent, it contradicts other elements of the bill. And you ask yourself, why is the haste? Where is the deadline? It's not as if we were where we were a year ago with the banking issue, where there was a deadline. If you didn't act on TARP, you could have had a collapse of our economic system. Here, the deadline is entirely a political one. It's because Democrats know that with all this opposition in the public, and with an election year looming, they have a very small window. It's not as if the medical system will collapse on January the 1st if nothing is done. It is entirely artificial, and it is causing these new amendments and these new ideas to be thrown in untested, even unexplained at the last moment.
But this is not the first time you've seen action like this out of Congress. After all, when the Republicans were in charge, they passed the Medicare prescription drug bill, and it was a scramble just like this, and they kept the vote open for 2.5 hours.
This is reforming 1/6 of the U.S. economy. Well, it's not a targeted reform. It's a revolution in health care.
Well, Medicare Part D was the biggest addition to Medicare, since Medicare was enacted.
This is an IED.
We'll leave it there.